Today, we're going to be discussing exertional heat illness diagnosis and treatment. What is exertional heat illness? It's a medical condition resulting from the body's inability to cope with heat during exercise. There are 4 types: heat muscle cramps, heat syncope, heat exhaustion, and heat stroke. We will focus on the last 2. Someone who might have exertional heat exhaustion may present these following signs and symptoms: dizziness, nausea, vomiting, elevated core body temperature, usually less than 105 degrees Fahrenheit, extreme thirst, generalized fatigue, fainting, diarrhea, lightheadedness, and pale skin. Someone who might have exertional heat stroke may present with these following signs and symptoms: dizziness, nausea, vomiting, an elevated core body temperature of 105 degrees Fahrenheit, headache, generalized fatigue, confusion, hot and wet skin, personality changes, they are combative or there's a drastic mood change, or they may lose consciousness. Heat stroke is a medical emergency, so call 911. The gold standard to check core body temperature is with a rectal thermometer. Besides the rectal thermometer, you will need gloves, towels if possible to have coaches help provide a screen and some privacy for your patient, some tape, and lubrication if needed. These are the steps for using a rectal thermometer. First, remove the athlete to a shaded area if possible. Drape the athlete for privacy. Ideally, you want them side laying, but prone position is fine. The thermometer should be cleaned before using. Lubricate the probe if needed and make sure the thermometer is turned on. Regardless if they're side laying or prone position, insert the probe 4 inches past the anal sphincter. If you meet any resistance, pull out the probe and insert again. Once the probe is in place, tape the probe cords in 2 spots to help make sure it stays in place. Leave the probe in there for the duration of the treatment and check the temperature every 5 minutes. Once the core temperature is 102 degrees Fahrenheit, remove the probe. There will be a video demonstration on the next slide. For this demonstration, we're going to be using a model and a flexible rectal thermometer. Treatment for exertional heat exhaustion can go as followed. Stop activity, remove any extra clothing, and move to a cooler environment. Cool with cold ice towels or ice bags. Monitor vitals. Rehydrate with fluids. Returning to activity the same day is not recommended. Treatment for exertional heat stroke needs to go as followed. Call 911 since it's a medical emergency. Rapidly cool the individual in a cold tub or a tarp to perform the taco method. Multiple people need to be included, so educate your coaches on this treatment. Continue to swirl the water around to increase cooling. Monitor vitals. Rehydrate with fluids. And once the core temperature reaches 102 degrees Fahrenheit or less, they can then be transferred to EMS care. There is still no set standard for return to play after heat stroke. Your team physician or medical director needs to clear you in order to start the gradual progression protocol to get you back on the field.